Welcome to Akron Public Schools and to the online orientation program for newly hired faculty. This information is regarding the different benefit programs available to APS employees. At Akron Public Schools, we recognize that employees have diverse needs when it comes to employee benefits. So we have developed an employee benefit program that allows you to select benefits best suited to your personal situation and needs. There are several different online resources that will also provide you with more detailed information regarding your benefit choices and the enrollment process. You are encouraged to download and review this information before you complete the enrollment process. So let's get started with the basics regarding your employee benefits. Most positions are considered as benefit eligible. However, the union contract will typically dictate the positions that are deemed eligible for benefits. For our purposes today, individuals assigned to either a full-time teaching or counselor contract are considered benefit eligible employees. The effective date of eligibility is also determined by the applicable union contract. Again, for our purposes of this presentation, most of you will become eligible for medical insurance benefits as of the effective date of your contract. For most of you, that will be between August 1st and August 22nd. If you have any questions about your eligibility date, don't hesitate to contact the benefits office directly. The district offers employees comprehensive benefits that include medical, prescription, dental, vision, Paladina Health Services, and flexible spending accounts. Medical health insurance benefits are provided by Medical Mutual of Ohio, PPO. With a PPO, or Preferred Provider Organization, network selection is extremely important as your out-of-pocket expenses increase if you are using a non-network provider for any of your healthcare needs. Akron Public Schools contracts with Express Scripts for all prescription benefits. Our prescription drug plan is a 3-tier plan, which means your copay for the prescription drugs depend on the type of medication that it is. There is a $10 copay for all generic medications, and either a $30 or $60 copay for all name brand medications. Express Scripts determines the medications that are considered as formulary or non-formulary. Typically, specialty medications and medications with high ingredient costs are considered as non-formulary. Employees must use mail order pharmacy for all maintenance medications. These are the prescriptions that you may take on a regular basis where the dosage level does not change. For all other prescriptions, a retail pharmacy can be used, and members must use a network participating retail pharmacy in order to receive prescription benefits. Most large pharmacies, including Giant Eagle, Mark's, Walmart, Acme, Target, Rite Aid, and CVS, are included on the Express Scripts network. All dental insurance benefits are provided through Delta Dental Network. Here again, there is a definite incentive to use a network provider as your copayments go up each time you use a dental provider that is not on the Delta Dental Network. Your preventative services, exams and cleanings, are covered at 100%, and depending on the type of service, cavity, root canals, etc., the insurance will cover either 70% or 80%. There are also orthodontic benefits available under our plan. All vision benefits are provided through VSP. In order to be eligible for benefit coverage, you must use a VSP provider. VSP is one of the largest networks of vision service providers in the United States, so finding a doctor or facility that is a registered VSP provider should be very easy for you. Akron Public Schools has partnered with Paladina Health to provide a truly innovative and unique benefit offering to employees. The Paladina program does not replace any medical insurance benefits offered through Medical Mutual of Ohio. The Paladina program is an additional benefit offered to employees. The program is voluntary, and eligible employees can elect to enroll in the program at any time throughout the year. Paladina Health provides primary care services for you and your family with no additional copayments or monthly membership fees. Paladina Health doctors offer a scope of services that is much broader than a typical family medicine practice. This means that you may be referred to specialists for services that your primary care physician could do in the office, but he or she simply doesn't have the time due to the high volume of patients that he or she treats on a daily basis. This means that the cost of your care increases through additional office visits and copays, specialist visits and copays, visits to urgent care, etc. With Paladina, you have access to contact your doctor 24/7 for all urgent needs. You will never wait 6 weeks for an appointment or wellness checkup with Paladina, as Paladina doctors have a patient caseload between 750 and 800. The average family physician practice patient caseload is between 1,500 and 2,000 per physician. With Paladina, your doctor will split the time that you need for your appointment, and you will not experience long waiting times in the waiting room. In fact, on average, Paladina patients spend less than 5 minutes in the waiting room. Please visit the APS Hub for more information and additional videos related to the services offered through Paladina Health. A flexible spending account or FSA plan is available to benefit eligible employees on a voluntary basis. This plan allows you to use tax-free income to pay for your out-of-pocket qualified medical expenses. You determine the annual amount that you would like to have put in your flexible spending account, any amount from $100 to a maximum of $2,500 per year. The amount that you elect for your spending account will be deducted from your paychecks throughout the year. Please note that the FSA plan runs on a calendar year basis, so be cautious regarding the election that you may make if enrolling after the first day of the calendar year. If you participate in this program, you will receive a Visa debit card that you can use to pay for your eligible medical expenses. Some examples of eligible medical expenses include office visit copays, prescription copays, LASIK surgery, glasses, and dental expenses. Please see the Hub for specific details regarding eligible expenses and program specifics. APS also offers dependent care savings accounts to benefit eligible employees. This plan is very similar to the FSA, but any elected deferred funds need to be used to pay for eligible daycare or childcare expenses. As with FSA, the dependent care savings accounts will allow you to use pre-tax dollars to pay for expenses, and you determine the amount that you would like to defer for the calendar year up to a maximum of $2,500. Because spending accounts are regulated by the IRS, there are numerous regulations and standards that this program is mandated to follow. If you are interested in participating in either or both of these programs, please make sure to check the APS Hub for additional details. So up to this point, we have covered the basics regarding the group health benefits that are available to you. There is a complete benefit guide available to you as one of the documents associated with this presentation on the new faculty orientation site. A complete benefit plan breakdown and detailed information are provided in this publication, so I would encourage you to download the guide to use as a reference. Additional benefits are offered to APS benefit eligible employees. Let's take a look at these. Being healthy and feeling great helps us do our jobs better and live happier, more productive lives outside of work. To encourage good health, APS has worked to develop and implement a wellness program for all benefit eligible employees. This program offers the opportunity to participate in a screening program that will give valuable insights about your health. This program combines a health risk assessment questionnaire along with a biometric screening process that will let you know your numbers. When you know your risks and your numbers, you and your healthcare provider can set goals and discuss lifestyle changes that can help you stay healthy or become even healthier. The program is completely confidential and is offered on a voluntary basis. The best part of the program is that if you participate in the risk assessment and screening program, you will receive a monthly discount on your employee premiums for the calendar year. There are also opportunities to participate in fun challenges throughout the year if you choose. Group term life insurance benefits are offered at no cost to benefit eligible employees. The amount of the life insurance policy issued to you is determined by the applicable contract, but in most cases, the policy is for 1.25 times your base annual earnings. Additional supplemental life insurance benefits are available to you, your spouse, and your dependents if you choose through the Voluntary Benefits Program. All premiums for additional policies are paid through payroll deduction and in most cases are available with group discounts and savings. The APS Employee Assistance EAP and Work-Life Program offers access to confidential professional support 24 hours a day, 365 days a year. This program includes access to phone consultations, 6 complimentary face-to-face counseling sessions per person per occurrence, plus an expansive collection of additional resources. All EAP benefits are provided through Tri-County EAP services in a professional and confidential manner. You, your spouse, and covered dependents under the age of 26 are eligible for all EAP benefits. Employees can access EAP benefits by contacting Tri-County at the service number listed. It may sound silly to think about retiring when you're just about to start your new job, but as a new employee, there are a few factors that you need to be aware of. Most of you will participate in the state teachers' retirement system. However, job positions will usually dictate the retirement system to which you belong. Participation in your retirement system is mandatory. You will contribute a percentage of your earnings towards your retirement each pay period. In addition, Akron Public Schools will also contribute a matching percentage amount toward your retirement pension. Once you begin receiving your semi-monthly paychecks, STRS will send you participation information regarding your account. It is important to review your first several statements to make sure that the correct demographic information has been reported for you. APS also offers voluntary 403B retirement savings options to all employees. If you elect to participate in a voluntary 403B program, you will need to elect to have a certain amount or percentage of your earnings deposited into a retirement account. This program has several different tax advantages as the amount you invest in your retirement account is done on a tax-deferred basis. All 403B plans are set up through the payroll department, and more information is available on the Treasurer's Department hub page. Voluntary benefits like term and universal life insurance, short-term disability, accident insurance, and LifeLock coverage are available to all benefit-eligible employees, and you have the option to customize your benefits based upon your individual needs and budget. All policies are fully portable and belong to you in the event that you leave employment with Akron Public Schools. All premiums are paid through payroll deduction. We hope that you are never injured as a result of performing your job for Akron Public Schools. If you are, the district participates in the State of Ohio Workers' Compensation System. All accidents need to be reported as quickly as possible, and in most circumstances will need to be reported to the benefit office within 24 hours of occurrence. You will be asked to complete an accident packet, regardless of whether you sustained an injury, to document the incident and provide notification of any type of corrective action, such as a maintenance work order, so that future incidences can be averted. Now let's take a look at benefit details. Let's talk about who can be covered under you on the APS benefit plan. At your discretion, provided all eligibility standards have been met, you decide who will be covered as a dependent under your APS benefit plan. An eligible dependent can be any of the following. Number 1, your legal spouse. You must have a valid marriage license in order to validate any eligibility as a spouse. Number 2, your children up to the last day of the month in which they turn 26. Any child over the age of 19 is considered as an adult dependent under group health insurance terms. Insurance companies define children as your natural child, your legally adopted child or child placed with you for adoption, your stepchild, a child for which the court has granted you legal custody, or your natural or adopted children as required by a qualified medical child support order. Did you hear me correctly when I said that you can cover your children up to age 26? As adult dependents, any child over the age of 19 is eligible for medical and prescription benefits only. If your child is age 19 to 25 and is a full-time student, he or she can be eligible for dental and vision coverage as well. As part of the enrollment process, you will be asked to provide documentation regarding eligible dependents. Documentation may include a copy of a birth certificate, copy of a marriage license, confirmation of full-time student status, etc. Once enrolled, you will have at least 2 weeks to submit copies of requested documentation. APS does have a spousal coordination of benefits provision under the group health insurance program, and this provision only affects medical and prescription coverage. APS will ask for certain documentation regarding requested coverage for your eligible spouse. Spousal coordination of benefits will determine if the APS plan is the primary coverage for your spouse, or if APS will be the secondary payer of benefits for your spouse. This is how it works if your spouse is offered and eligible for benefits through his or her employer. A spousal coordination of benefits provision may apply to your situation. If your spouse is eligible for benefits and pays 25% or less of the monthly premium cost, spousal coordination of benefits applies to your situation. Notice that I didn't say if your spouse participates in the benefit plan offered by his or her employer. The APS spousal coordination policy applies to any situation where a spouse has access to other health insurance coverage, not necessarily whether the spouse participates in that coverage. For example, I elect to cover my spouse under the APS plan. My spouse is eligible for coverage through his employer, but would be required to pay 35% of the total premium to have medical insurance coverage. In this situation, because my husband is required to pay over the 25% employee premium threshold, spousal coordination of benefits does not apply to him. So let's suppose he only pays 5% of the premium. What would happen then? Spousal coordination would apply to this situation. He could still have coverage through the APS plan as a spouse, but this coverage would be secondary coverage only. Therefore, he would be required to at least elect single coverage through his employer plan, and this coverage would be his primary insurance coverage. Please contact the Benefits Office if you have any specific questions regarding spousal coordination of benefit situations. It is also important to note that you will need to communicate with the Benefits Office for any change in family status that you have that may affect or change your benefit elections or the benefit programs that you participate in. Anytime you have a change in your family status, you will need to contact the Benefits Office. Just a few examples of changes of family status are marriage or divorce, birth or adoption of a child, death of covered family member, spouse or dependent has a loss of their other insurance coverage, dependent children 19 or older that is no longer a full-time student. You are probably wondering what it's going to cost you for your health insurance benefits. The monthly employee premium, or the amount that you are required to pay for insurance coverage, is $60 per month for single coverage and $140 per month for family coverage. Please note that these premium charges do not include any premium discounts. As an employee, you have the opportunity to lower your monthly premiums for health insurance coverage. All premiums for health benefits are paid through automatic payroll deductions. APS does offer a program for employees who elect not to participate in the group health insurance benefits offered to eligible employees. Employees who have a coverage through another plan, usually through their spouse, can receive an annual lump sum payment for not participating in the benefit plan in Akron Public Schools. In order to qualify for this program, you will need to provide proof of other health insurance coverage. APS uses an online benefit management system called Explain My Benefits. This system allows you the opportunity to have 24/7 access to benefit elections and information. You can use the convenient online system or download the app to any smartphone device. You can use the electronic enrollment system for initial enrollments, reporting any changes in family status, change beneficiary designations, access benefit guidebooks, forms, etc. at any time. You have successfully completed the benefits portion of the new employee orientation. Thank you for your time and attention. Remember, if you have any questions or need additional information and resources, do not hesitate to contact the Benefits Office. Contact information is also included in the benefit guide. Welcome to the APS family.